name is Steph and I'm the clinical lead for Inpatient Therapies at the Rotherham NHS Foundation Trust. Today I'm going to talk to you about the Discharged to Assess pathway that we started in May this year. So I'm going to share today the benefits of the Therapy Discharge to Assess team and hopefully show you some members, as well as the patient and some patient relative feedback.
Hello, my name's Sandra Cheshire. I'm occupational therapist with the Therapy Discharge to Assess team.
And I'm Ameera. I'm also in a team, the Discharge to Assess team. So the purpose of the Discharge to Assess pathway is you can't replicate somebody's home environment in hospital. So we can do our assessments in hospital and see how they are managing, and they might be absolutely fine, but then when they get home they might have obstacles in the way that they're not going to manage, or they might not be able to manage in hospital but are absolutely fine when they're in a familiar environment like their own home.
Yeah, we come out from the referral process. We get goals, and every patient, they all have their own individual goals that they want to achieve on the Discharge to Assess pathway. So what we've done with Peter today is not necessarily going to be the same for the next person.
So we know that they're at risk of deconditioning, these patients, so as soon as they are deemed community ready, we want them to be referred to the Discharge to Assess team. This is a true patient-centred journey, and each patient journey is very different, but we're able to give them the opportunity of being assessed at home. The patient chooses what they want to show us, what they want to be assessed at home. I think there's a real good benefit, making it definitely person-centred. We always say in Rotherham, you look your best when you're up and dressed, and we want to promote Rotherham reconditioning. So what better way to be able to do that when we do our assessments at home? And I think definitely this pathway, especially, the patient's been successful and really benefited from that. Also, it's for the relatives, they felt more comfortable being able to do this, and hopefully having that relative at home for them to ask questions with the therapist has been able to be kind of more accurate and gathering that social history.
But I think because you've got that patient at home, you then see. So you can discharge somebody from hospital, oh there you go, there's your frame, etc. But then seeing that patient at home does make it more beneficial for them.
Yeah. So part of our assessments is potentially taking them up on the stairs, getting them up and off the sofa, and even making a cup of tea. The therapist will very much tailor it to what they need at home. So the outcome of the assessment will be explained to the patient afterwards, and then the next steps will be discussed with them. Many patients like to have the family member present, and we absolutely welcome this.
Hi, I'm Sue. This is my dad. Not that long ago he was in hospital with pneumonia and he was very poorly, but he got to the stage where he wanted to come home, and I just can't say how amazing things were. I was shocked. The hospital had got him using a frame which he hadn't used before. I said, well, would he be able to have a frame? And they literally said, well, when these ladies come out the meeting, we'll get you one. And within an hour we had a frame. My dad was in the car coming home, and it was so quick that the team came round, assessed my dad and assessed the house and gave us all the equipment that was needed. It was almost immediate. I was really surprised at how fast it was, and how efficient and how lovely everybody was, how well they explained things. Oh, it was just wonderful, thank you.
My name is Nicola, I'm clinical specialist OT on the Therapy D2A team. I hope you found the information so far really useful in terms of what D2A service can provide to patients. I would like to give you a little bit of an update on Peter, who you saw in the video. He's doing really well at home. Him and his daughter feel that he's managing really well. He has progressed from using the frame to walking independently with no walking aids around his property.
So as you can see, the Therapy Discharge to Assess team has been beneficial, being able to give that patient-centred journey. This is all what we're trying to do as an organisation, being able to be one big team to help patients be at home to be the best they can be. Ultimately, we want to be able to show that Therapy Discharge to Assess can create that person-centred journey, starting in the acute hospital, working towards getting them better, to getting them community ready, and continue those assessments at home. We always like to remember, and the patients say to us, you look your best when you're up and dressed.